Hi, thanks for tuning back in. This is the Wyoming Vein Specialist and Casper Medical Imaging YouTube channel, and I'm Dr. Charles Boukley. Last time, we took a deep dive into some conservative measures and endovenous laser ablation, or EVLA, sometimes talked about as EVLT. That was a long segment, and so we kind of stopped it early so that we could give you a shorter segment about the VenaSeal, or the cyanoacrylate closure. Cyanoacrylate is basically a type of medical grade superglue. And if you can think of the thickness of honey, that is basically the thickness of the glue. We talked a lot last time about how you actually access the vein, and with this small drinking straw and a catheter, the VenaSeal system works in a very similar fashion. The catheter is a little bit larger, but once inside the vein, you don't require the tumescent anesthesia, that halo of safety that we talked about. Instead, because that catheter is larger, you typically get what's called a little bit of venospasm around that catheter, and the vein itself will kind of cinch down around that catheter. If you don't get that cinching and it's a large open or patchless vein, then the instructions for use are specifically directed towards compressing the venous walls together. Because the way that the VenaSeal device works is that that honey-thick liquid is injected into the vein while the vein is being compressed, and then it's slowly withdrawn with more honey-thick liquid being deposited along that vein. That honey-thick liquid, again, is cyanoacrylate, or crazy glue, essentially, for inside the veins. It's a permanent device that's implanted in you forever. Some patients get a foreign body reaction to it. A small percentage of patients will actually get an allergic reaction to it. We try to screen out those patients before we attempt to do a procedure on them. And then there are even some skin tests that you can do in the forefront of that to determine whether or not a patient's going to react to it. This is great for patients who absolutely cannot tolerate compression hose, but I tend to use it very sparingly in our practice because laser is so well tolerated. So that's a quick drive-by of VenaSeal, or cyanoacrylate closure. Thanks for tuning in, and remember, we'll walk with you until your legs are healthy again.